All right. Hello, everyone. My name is Yuichi Mori, a gastroenterologist researcher at the University of Oslo and the Showa University in Norway and Japan, respectively. And Gloria?
Hi, good afternoon. My name is Gloria Fernández-Esparrach. I'm a gastroenterologist working at Hospital Clinic in Barcelona and at the University of Barcelona as well.
Thank you very much. So on behalf of the co-authors, I would like to introduce our recently published piece in GIE. The title of our paper is Artificial Intelligence for Disease Diagnosis, the Gold Standard Challenge. We consider this paper very, very important, especially for those who are engaged in the research on the AI tools in colonoscopy. It is our great pleasure to share our thoughts via this video conversation or presentation. So firstly, I would like to introduce the main focus of this paper. The primary aim of this paper is to catch attention to the major challenges in computer-aided prediction of histology, or CAT-X. With the increased use of AI for polyp detection, a concern arises in relation to overdiagnosis and overtreatment in colonoscopy. In this regard, CAT-X would be a nice mitigation measure to reduce overtreatment by identifying what should be removed from what should not be removed. However, there is a serious gold standard challenge in the development process of the advanced CAT-X, namely unreliable pathological diagnosis are a really big challenge. So basically, development of CAT-X needs accurate pathological diagnosis of polyps, which are used as gold standard for machine learning. However, these pathological diagnoses are subject to significant inter-observer variability among pathologists. For example, kappa values ranges between 0.4 and 0.7, which is not optimal. This precludes a correct labeling of polyp images to feed the computer. Thus, it is basically very difficult to create a reliable CAT-X system in colonoscopy because the performance of the developed CAT-X tools depends on the accuracy of the histopathological diagnosis. Our piece clarifies this challenge and explores the solutions that enable optimal development of a reliable CAT-X tool. So now I would like to ask Gloria one relevant question. So in this paper, we focus on the gold standard challenges when we develop a CAT-X model. However, I have one question regarding this matter. Do we have a similar challenge when we validate the model performance in clinical practice or clinical trial?
Thank you for this relevant question, because the answer is clearly yes. The gold standard is also a big challenge when we are trying to evaluate the performance of an intelligent system in real practice, even bigger than we are developing the system. Because if we want these intelligent systems to be useful for the clinicians, they have to demonstrate their validity in a real clinical setting. And we also know that in a clinical setting, everything is more difficult because the variables are not well controlled as when we are performing the study in an offline setting. The patient is moving, the patient is not good prepared, polyps are not totally exposed, they are not in a good location, we cannot assess the whole surface of the mucosal pattern. And even in these difficult cases, we also we still need to check the performance of the system, and we need to compare with the gold standard that, as you said before, is pathological analysis and is not good enough. What's the problem if we don't have a good gold standard in clinical practice? Is that we can overestimate or we can underestimate the performance of the model in the real setting, and we need that the clinicians, they trust the system, because if not, the system is not useful for the clinicians. Then summarizing my answer, I think that this challenge with the gold standard is also a big challenge when evaluating the performance of the systems in real practice. Yeah.
Sure.
Then in my turn, I will also would like to ask you a couple of questions. We are struggling on improving the performance of these intelligent systems, but do you think that there is still room for improving the endoscopy's performance? And a second question would be, will these intelligent systems be a complement for endoscopies, or contrarily, endoscopies decisions will totally rely on artificial intelligence predictions?
Gloria, thank you very much for facilitating our discussion. They are very important and relevant questions. So first of all, I think AI is definitely a complementary tool. However, it affects endoscopy's procedures very much. If you look back some clinical trials, which was published in some journal by our team, actually endoscopies were strongly affected by the decision made by the CADX. So we should take care of that in the future from the legal perspective or liability perspective. That's what I'm thinking about it. But basically, high quality examination would be the prerequisite for maximizing the benefits of both CADX and CAD-E or for polyp detection. For example, AI for polyp detection requires exposure of the mucosal surface during the procedure. Otherwise, it could not detect any polyps. So you should train yourself, because otherwise you cannot maximize your polyp detection. And also, this exposure should be done with the endoscopist's effort. And same applies to CADX. Unless you visualize a polyp in a nice manner, as you described, CADX could not provide correct prediction of the polyp pathology. In this regard, the endoscopists still have to do a lot of efforts and to do their best to obtain the best quality images. This is my perspective, Gloria.
Thank you very much. I think that this paper is very, very interesting because it opens new perspectives for the readers of the journal. And I would like to summarize our discussion here. I think that artificial intelligence systems, they have a great potential in endoscopy for both detection and characterization. And there are still many challenges that we have to solve to have better results. And I think that even if these intelligent systems will have or will reach a very, very good performance in the future, I think that they will not replace the need for having very good skills for the endoscopists, and they will be a very, very useful and necessary complement for endoscopies. So thank you very much for your attention.
Yeah.